Aloha, everyone. Welcome back to the negotiation table. My name is Wincy Hong, your host and communication specialist here at HGEA. And with us today, we have Unit 9's Jojo Kawana, a nurse at the Hawaii State Hospital and a member on HGEA's board of directors. Welcome to the podcast, Jojo.
Thank you, Wincy. Good morning.
Good morning. Before we dive into this month's conversation, don't forget to hit the like and subscribe button so you never miss an episode. Okay, let's dive in. Nurses Week fast approaches, and this year, HGEA's message for the state about public sector nurses is, they're heroes. Let's treat them like it. That's because workplace safety issues and staffing shortages are dominating the conversation right now. Recently, the condition of the Hawaii State Hospital has been in the news, along with nurses across the state pushing safer nurse-to-patient ratios. So Jojo, let's start overall with the nursing shortage in the public sector. Recently, the Hawaii State Hospital administrator said there are more than 240 staff vacancies, many of them nurses. The state admits to having to turn to temporary or agency hires to make up the gap. Can you talk about the impact of staff shortages on your day-to-day job?
We are scheduled short every day, every shift. HSH staff working overtime is one method being utilized to meet the staffing needs. Whenever staff needs can't be met by our current HSH staff, it's being met and supplemented by temporary and agency nurses. HSH received 51 citations from the Joint Commission. HSH nurses are being given the additional task of correcting the violations and along with doing our own job, our same job responsibilities. The nurses need to be part of the solution, but having to cycle through transient staff makes it difficult to build any kind of continuity between the nurses on all three shifts. You find yourself having to constantly train new staff only to have them leave shortly. The burden needs to be shared with everyone equally by the state, for a solution to the ongoing problems can never be solved. Individual nurses have no ability to dictate competent staffing. This creates an additional burden that makes every shift, every day more difficult than it needs to be.
Recently, lawmakers were shocked to discover a new building, just 4 years old, required about $40 million in repairs to address health and safety issues. But this shouldn't be a big surprise given that HGEA members like you have been speaking out about these concerns from the very beginning. And in a recent KHON story, one nurse called the conditions, quote, horrific. What were some of the problems you were raising going back to 2021, and what are the conditions like now?
We were the first unit to move into the new building. The ceiling leaked shortly within a month. There was water coming in from the windowsills. The winds were coming in through the emergency fire doors. Now, if the wind can come in through the draft, then the concern is smoke certainly can come in through these emergency fire doors. There's concrete in the plumbing. The showers were clogging and draining into our hallways, which brings us to another problem. The mold due to all the water damage and the water leaks. And my goodness. And now our PMTs, the personal mobile transmitters to activate in case of an emergency, that's not working. It's intermittently working in the new building. Mm-hmm. Now our badges, our swipe badge to enter in and out of our building is also not working. The electrical problems that came with the building or because of the water infiltration into the electrical system, that's also a problem. But yes, they're still there.
Aside from this new building, safety concerns at the Hawaii State Hospital have been a perennial problem going back many decades. HCA has filed numerous grievances and prohibitive practice complaints on behalf of nurses. You spoke out about safety issues following the death of Justin Bautista, an employee at the hospital and UPW member. Can you talk a little deeper about the fears of employees who work at HSH? What's it like going to work scared for your own safety?
Many of our patients have violent histories and are court committed, and that's one fact that makes our job difficult. But unfortunately, HSH administration has ignored its own policy concerning workplace violence. Employees have been verbally abusive to the patients and staff, and having to come to work to endure the dangerousness of our patients is just unfortunate. But administration turning the other way shouldn't be. Mm-hmm. You know, I recently won a arbitration filing against HSH for violating the Code of Ethics, Code of Conduct, and the Workplace Violence and the Department of Health Workplace Violence Policy.
If you could say something to lawmakers or state officials about HSH, what would you tell them?
We are your constituents. We need your support. HSH administration needs to be held accountable for their actions. There needs to be oversight for our grievances and arbitration decisions. Advancing legislative actions through committees and onto the floor as recommended by HJ.
Switching gears slightly, the issue of safe nurse-to-patient ratios has also been in the news. Private sector nurses have made the issue central to their recent contract fights at Kapiolani Hospital and the Queens Medical Center. There are also several bills in the state legislature addressing the issue. How is this playing out for public sector nurses like yourself? And why is this issue important not just for the nurses, but for the patients too?
The nurse-to-patient ratio is an issue with no clear solution to fix it. When contract language will never truly resolve this. Units are over census with too many patients, not enough competent staff. Adding a staff member who is not trained to work while because of staffing matrix calls for it doesn't help either. Both Queens and Kapiolani contract added additional language for more collaboration with administration to address the staffing needs. There's also language that addresses the process when both sides cannot agree to the matrix. We'll be able to see in real time if contract language will make a real difference as both facilities are into their new contract. Kapiolani nurses lost a lot of time in this fight. And if it doesn't work, I believe we'll create for a more confrontational environment and low quality of care. As far as billing the legislative, the usual rhetoric seems to be the norm. They do agree. Patient and staff safety is one of the most important things in healthcare. However, deferring to the facilities and the unions to represent the nurses to address it in negotiations. Our public sector nurses work in a different type of environment with less specialty units in Queens and Kapiolani, trying to see what works with their contract or could be easier to incorporate with our negotiations. The issue of both patient and nurses can determine both short and long-term outcomes. Patient will have a shorter recovery time and a better health outcome, and nurses will avoid burnout and have a greater job satisfaction.
Obviously, to address something like nurse-to-patient ratios, you need to address the scores of vacant nurse positions. which we talked about at the very beginning, the public sector is competing for nurses with the private sector, which is also facing its own staffing crisis. How can the state make government nursing jobs more attractive to job seekers? And is it all about pay and benefits, or are there other issues involved?
Sometimes pay and benefits are not the only issues with the nurses working in the public and private sector. The younger generations of nursing coming to the field looking for a career aspirations are different. Many of them do not look at long-term employment with one hospital or trying to establish a plan for the future. Working at the state hospital is probably not what they are looking for. Personally, the last few contract negotiations haven't had any take-backs or bad contract language that negatively affected us. The private sector's facility had gone through work stoppage and a very contentious lockout with Kapi'olani. Our negotiations may be tough at times, but we have always had a positive outcome. I have never lost work opportunities because of low census. I have a vacation and sick leave plan that's significantly better than a PTO plan that most private facilities have. If I was to discuss the benefits of being a public sector nurse, that's where I would start.
We know our healthcare heroes need our thanks and support. We want to mahalo you for serving our community even under very difficult circumstances. Can you say a little bit about the hard work of your colleagues and what makes them so special?
Oh, our HSH nurses. We work with some of the most dangerous and unpredictable patients in the state. We float to different units to work with staffing shortages with too many patients. Our staff have endured assaults, injuries in the course of our jobs. We have gone through numerous changes in administration. Our priority is always patient safety and to ensure the safety of our coworkers. And through it all, the challenges and dangerous working conditions, we still come back.
And Jojo, we really appreciate you taking time to talk to your fellow HCA members. Do you have any last thoughts that you would like to share?
I believe I'm better with my union than without my union. We're all in it together, and unity is our strength.
Absolutely, we are definitely stronger together. Mahalo for that. We're really grateful for everything that you do. HCA nurses truly are an example of Hawaii working best when we do. So join the conversation, everyone. In the comments, let us know if you have a message for our state nurses as we approach Nurses Week. And tell us in the comments if you yourself are a nurse at the state hospital. For more content like this, don't forget to like and subscribe. Until next time, thank you so much.